Hello everyone, I'm Sun-Hui from the Department of Rheumatology, the first hospital of China Medical University. Today we will talk about systemic lupus erythematosus. Briefly, we can call it SLE or lupus. And today we will talking about the treatment of lupus. To be honest, at this time, there is no cure for lupus, and the complete sustained remission are rare for lupus patients. But there is obviously certainly is effective drug therapy to control the disease activity. The treatment for lupus including the general treatment, the drug therapy, the plasma exchange, and the hematopoietic stem cells transplantation. The general treatment including the psychotherapy, because the patients may feel worried about this disease and feel worried about the adverse effect of the drug therapy. So the psychotherapy is very important. And the rest and infection prevention is also important to avoid the disease flare or to avoid the trigger the disease. And also we need to tell the patients to avoid the drug-induced lupus, such as the penicillin, the interferon alpha, the anti-TNF alpha drugs. Also to avoid ultraviolet ray, avoid exposure to such kind of ray. And during the disease activity period, no vaccine injection is allowed. For the medication treatment, including the NSAIDs, anti-malarial drugs, corticosteroids, immunosuppressant, and biologic therapy. The NSAIDs is non-steroid anti-inflammation drugs. It's used for the anti-inflammatory and analgesics. Used for the fever, for the arthritis, for the myalgia, and also for the mild serositis for lupus patients. And the typical drug for NSAIDs including the aspirin to Celebrex. The side effect for NSAIDs including the digestion ulcer, the bleeding and the perforation of the ulcer system, of the digestive systems, and also including the damage of the liver and the kidney. Some patients may get mild edema during the NSAID drugs intake. And for the specified COX-2 inhibitor may risk increase the myocardial infection. So for such kind of patients which are myocardial disease, we will avoid to use COX-2 inhibitor. Anti-malarials, hydroxychloroquine, in briefly we can call it HCQ. First, the drug was used to malaria, but lately the doctors see the use of HCQ in the lupus treatment. It can be used for the skin rash of the lupus patients. It's very useful to control the skin rash. And it can be also used for the arthritis, for the myalgia, and for the mild serositis, for the fatigue. And at this time, the HCQ is the background drug for the lupus therapy, because this kind of drug can avoid the lupus flare and can increase the survival of lupus patients. So it's a background drug for the lupus therapy. And the dosage for the HCQ is 200 to 400 milligrams per day. The side effect for HCQ, first one is the heart conductive system. HCQ can cause the bradycardia. So before the use of HCQ, we need to do the ECG for the patients. If the patients got bradycardia, we cannot use HCQ. Another side effect for HCQ is the retinal toxicity. So it can cause the macular degeneration, and before the use of the HCQ, the patient should undergo the ophthalmologic examination. And during the use of this kind of drug, the patient should undergo the eye examination annually. Corticosteroids in the clinic, we mostly use the prednisone and the methylprednisolone for the lupus therapy. The doses of the corticosteroids can be divided into low doses, mild doses, high doses, and pulse dosage. The low doses mean less than 10 milligrams per day, and the mild doses is from 11 to 40 milligrams per day, and the high doses from 41 to 100 milligrams per day. And the pulse dosage means 1,000 milligrams of prednisolone intravenous each day, and usually used for 3 days. The pulse dosage for the corticosteroids is usually used for the symptoms of the life-threatening, such as the NPSLE or severe lupus nephritis. The side effects of corticosteroids include the edema, the fat, and the moon face, and it can also cause the infection, hypertension, and the psychiatric syndromes. Also, it can induce the diabetes, glaucoma, and osteoporosis. So during the use of corticosteroids, we should evaluate the side effect of such kind of drug to avoid the side effect occur. There are still some problems for the corticosteroids use. One is some patients do not respond to corticosteroids. Some patients may respond initially but relapse when the dose is tapered. And also, the toxic side effects of corticosteroids are still universal sometimes. So, cytotoxic drugs are needed to use for the life-threatening lupus, such as the severe form of lupus nephritis or the NPSLE. By the use of cytotoxic drugs, the patients can reduce the doses of corticosteroids, so it can reduce the side effect of corticosteroids. The typical cytotoxic drug is CTX. CTX is alkylating agent. It's more effective, but the side effect for CTX is also more toxic. It's usually used in the induction of lupus remission, and it can suppress both humoral and cellular immune responses, especially used for the renal biopsy, so grade 3 or grade 4 diseases. And the dosage for CTX is usually 1 gram per month, and usually used for half a year. And it requires 2 to 16 weeks to work well. The side effects for CTX including the bone marrow suppression, leukopenia, infection. And the special side effect for CTX is the infertility and the menopause. So for the young woman patients in the childbearing age, we should be careful to use CTX for such kind of patients, because CTX can cause the infertility and the menopause. And there are some other side effects for CTX as nausea and alopecia. MMF is another effective drug for the induction of the lupus remission. It's a relatively lymphocyte-specific inhibitor, but the initial dose for the MMF is 1.5 to 2 grams per day, and the maintenance dose is 0.5 to 1 gram per day. The side effects for MMF, including the infection, leukopenia, and bone marrow suppression and nausea, but the infertility and the menopause in the MMF use is rare. So for some young woman person who in the childbearing age, we can use MMF instead of CTX for the induction of remission of lupus. Imurin is a purine analog and is anti-metallic drugs. The effect of imurin is less than the CTX and MMF. But if the other immune suppressive drugs cannot be used or cannot be tolerated, Imurin can be used. The dosage for Imurin is 1 to 2.5 mg per kilogram body weight per day. The side effect for this drug is allophenia and bone marrow suppression and hepatic damage and infection and nausea. MTX is a folinic acid antagonist. It can be usually used in the treatment of rheumatoid arthritis. But in lupus patients, MTX can be used for the treatment of arthritis, myositis, vasculitis, and even can be used for the treatment of skin rash for lupus patients. But it cannot be used in the nephritis or other life-threatening disease. The dosage for MTX is 10 to 20 mg per week. The side effects for MTX including the alopecia, bone marrow suppressor, hepatic damage, nausea, and infection. The specific side effect for MTX is the ALD. So for such kind of patients, lupus patients with ALD, we should avoid use MTX. Leflunomab. Leflunomab is usually used for the treatment of rheumatoid arthritis. This kind of drug is a relatively lymphocyte-specific antagonist. It can suppress disease activity in some lupus patients, but it be used usually in the remission stage of the lupus patients. It cannot be used in the severe lupus nephritic patients. And CSA and the tacrolimus can inhibit the production of IL-2 and T lymphocyte functions. These two kinds of drugs are usually used for the class 5 lupus nephritis. That means used for the membranous lupus nephritis. And dosage is 3 to 5 mg per kilogram body weight per day. The side effects including the hepatic damage, hypertension, diabetes, and nausea. But the effect on the blood cells is seldom occur for these two kinds of drugs. There's still a cocktail therapy for the lupus patients. The cocktail therapy means low doses of glucosteroids plus low doses of MTX plus HCQ. This kind of therapy is used for the mild lupus patients, not for the severe lupus patients, especially for the lupus patients with no lupus nephritis. In this kind of therapy, because we use low dose of glucosteroids, so it can decrease greatly the side effect of glucosteroids. There are some other therapy, including plasma exchange. Plasma exchange can get rid of the all antibodies in the cell of the lupus patients. And the hematopoietic stem cell transplantation. Hematopoietic stem cell transplantation is used for severe lupus patients who do not respond to the traditional drug therapy. For the biological therapy, the belimumab is the only one biologic drug that be approved by the US FDA for the lupus treatment. The belimumab is a B lymphocyte stimulator inhibitor. It's a BLyS inhibitor. It can inhibit B cell survival and the differentiation to plasma cells. And there's another biological drug for lupus therapy is rituximab. But the effect of rituximab in the lupus treatment is controversial. Rituximab is anti-CD20 antibody, and some studies show the controversial result in the lupus patients therapy. Both these two kinds of biologic drugs in the lupus therapy can increase the level of complement and decrease the level of antibody, but its effect on the lupus nephritis seems limited. That's all about the treatment of lupus. Thank you very much.